Are dental implants dangerous? If you are thinking of getting a dental implant, make sure you listen and watch this particular episode. My name is Dr. Radwa Saad. I am a cosmetic and an implant dentist. I have a master's degree in implant placement and surgery, and I have been a cosmetic dentist for over 20 years, and I am based in the United States. I also have a license in Canada, in the US, and I did a lot of dentistry. So welcome to this exciting episode of the Wonder Tooth podcast. Make sure you subscribe, like, and share this episode so that you can come back and listen to more insightful details. So, what is a dental implant? I did it before and I talked about it before, and we're gonna talk again about it. So a dental implant is basically a root. We're gonna put a small root in the bone. Then on top of it comes a part that's called the abutment. And the abutment basically is like a smaller tooth, and then the crown comes on top. So the implant is basically made of three pieces. The root, which is the dental implant itself, then the abutment, and then on top of that comes the crown. Now there are two different types of crowns. There is a screw retained crown, then there is the cement retained crown. What is the difference? So the screw retained is basically the crown has a small hole on the biting surface, and this is when we go and screw it into the implant. So the implant, even though it looks like a root, there is like a little hollow inside the implant. So basically we screw the crown back in, and then that little hole on the top, we cover it with a filling, and this is very good for accessibility. Let's say something happens, the crown became a little loose, so instead of cutting it and become like a bigger disaster, we just kind of remove the filling, tighten it, and actually usually we like to remove it, clean a little bit, flush the area with some chlorhexidine, which is a medicated mouthwash. It's not over the counter. And then we put it back. We put a little tiny tape on top of the screw. Make sure that this is always placed. I mean, I'm pretty sure your dentist would know that, but this is just to prevent, stripping of the little screw. And then you put a filling on the top, you adjust it, and you're good to go. So this is basically what a dental implant. Now, is a dental implant really dangerous? Let's go back and talk more in details. So some people, they think, oh my God, I don't wanna get a dental implant. It's painful. It's always associated with pain. So true story. Yesterday, I had a patient. We pulled her molar like probably 4 or 5 years ago, and she's terrified. She's a very anxious patient, and I understand that. I mean, she's just terrified. And she works in the healthcare. And one of her, the doctors she's working with, they told her, why do you even want an implant? Just don't even ignore it. And she goes, I need it because I can't chew. But she's terrified of the whole idea, and she's too young to get a flipper or something removable. And she came yesterday and she's like, I'm terrified. I said, I understand that. And she's like, so what are we gonna do about it? I said, you're gonna be numb, you're gonna be okay, and there will be hardly any pain after. And why is that? Because basically half of the diagnosis and the preparation for that implant was already done outside of the mouth. And how did I do that? Okay, the standard of care really in implant placement now is not the small tiny x-ray that you put in the mouth and you do it. It's basically the 3-dimensional x-ray, which is called the CBCT, the cone beam. That's a CAT scan of the jaw, especially if we're doing it on the bottom or on the top. So this is number one. Then this is when, a skilled dentist can basically start to check the area where we're gonna put that implant. So we check the height of the bone, we check the thickness of the bone, we check if there are important, structures there. Like for example, on the bottom here, there is the big inferior alveolar nerve. And if that nerve gets hit, you're gonna get numbness. So we always have to make sure that we are at least 2 millimeters away from that nerve, always. And how we can do that? By selecting the proper size of an implant, the proper length of an implant. Then the thickness of the bone also determines how thick of an implant we're gonna put. Of course, the thicker implant, it's better, but sometimes we can we put a skinnier one depending on the bone, because you want 2 millimeters on the side of the implant too. So if, let's say, we have an 8 millimeter ridge, like the bone, I'm talking about the actual bone, and we can see that on that CBCT, the nice x-ray. So if I am measuring, and we have like a tiny little ruler, digital ruler, so I can measure, if I have an 8 millimeter now bone, how big of an implant I should go, like diameter? I'm gonna go with the 4 millimeter diameter because I need 2 millimeters on the outside towards the cheek side, which is basically, we call it the buccal side, and another 2 millimeter on the inside. Just to make sure that the implant, you're not gonna have recession around, like the bone is not gonna shrink. Even though at the beginning, once the implant is actually in function, you start to see a couple of, like a millimeter of like bone loss around the thread from the function. Anyway, this is basically number one that I told the patient. I already did the diagnosis and the preparation outside, so I know exactly which size of an implant we're gonna put. And in her scenario, she had a bit of like, it was on the top, so the floor of the sinus is coming close. So I said, okay, you have nice thick ridge, so we're gonna put a nice big 5 millimeter implant, but we're gonna put a little shorter implant. So her ridge between the bone and the floor of the sinus, we had around 6.5 millimeter. I need to put a 7 millimeter implant, nice 5 millimeter thick and a 7 millimeter high, or like the length. So what did we do? Very simple. We start, it's a simple process. We start to drill a little bit. Then I did a simple crestal sinus lift. So how do we do that? Well, I don't know if you guys are gonna get scared, but it's a crestal sinus lift. So at the time of putting the implant, I push a little bit of saline inside, so it kind of raises that membrane, the beautiful membrane. It pushes it up, and then I pack some bone, and then we put the implant, and that's it. And then as long as the cut is clean, which I always say, you have to go to a skilled dentist, surgeon, because if the cut is clean and the stitches is clean, you hardly get any pain after that. So this is a big one. Anyway, I got a little bit. So anyway, I was like, this is gonna take around half an hour. She said, only half an hour? I said, yes. Between numbing you and then I start to finish, you're gonna promise we're gonna be okay. She's not gonna panic or anything. And she said, okay. And I numbed her really well, and we just did it half an hour and she was done. Now, of course, the post-operative care, I'm gonna talk about it at the end of this episode. But first, are implant really dangerous? No, they're not. This is actually a very good alternative to people so that they can chew. I'm gonna have another episode to talk about the real big risk of having no teeth, having missing spaces between your teeth, and how that can really affect the shape of your jaw, the function, and then the TMJ afterwards, and just the whole facial expressions, basically. So that's like number one, the big, scary part for people. Are implant dangerous because they can cause pain? Hardly. Of course, if the dentist, they don't know what they're doing, or they make like a lousy incision, or they go too close to the areas that they're not supposed to, yes, there will be some pain. Now, the big thing is, can there be an infection? Yes. And that can happen really in 5% of implant placement. If the patient, they didn't really follow the regimen of the post-operative instructions, and also if they didn't tell the dentist about all the medications they're taking, not just, I have, I don't want to tell the patient, I don't want to tell the dentist what I'm taking. You should tell your dentist every single medication, because there are some medications that can cause delayed healing. Like some of them is basically, if you're taking steroids, corticosteroids, like over a period of time, it causes, delayed immune system and delayed healing. So you have to tell your dentist about that. But it's only around 5%, a risk of an infection. And if that's the case, usually after I put an implant, I always give them, antibiotic and a painkiller, and sometimes a strong painkiller. And if I'm putting an implant on the top, I always tell them you have to take an allergy medicine. I don't want you to sneeze. I don't want any allergies going on or sinus problem. I don't want any negative. I don't want you to sneeze, literally. And they look at me and they're like, and I'm like, just take the allergy medicine, please. And then you can supplement later on with, a little bit of calcium or vitamin D. It kind of helps with the bone. Now, another big question, can your body reject an implant? This is very, very, very rare. Like I would say probably 2 to 5%. And this is according to the literature. I don't come and say stuff here, like I do my research and I am really trained to do evidence-based dentistry. And how do we do that? We check the literature, we check the articles, and the best are basically if there is a meta-analysis for basically everything. So 2 to 5%, I wouldn't say really rejection of the body. I would say that there was an implant failure. So 95% of implants in general, they will succeed, and around 5% they can fail. And they can fail because of, different scenarios. One, of course, if you have some immune problems. Uncontrolled diabetes is a big one because, diabetes can cause a lot of infection in your body. Smoking also, because heavy smoking can, because it can affect the healing. And also poor oral hygiene. And I had another patient yesterday, not the lady with, another patient, and I'm like, are you brushing? Like, I placed like few implants. Are you brushing and flossing? We had stitches. And he's like, I have metal now. I am gonna have like fake teeth. Who cares about that? I said, implants, they don't get cavities, but they can get gum disease. And now he's looking at me and I said, they can get gum disease. So you can end up losing all the implants because we're not brushing and flossing. And that was like a mind-blowing thing. And I said, brushing, flossing, and use of a water pick. This is very, very important. So please, guys, do yourself a favor and make sure brushing and flossing and a water pick. Not brushing once every week. You have to brush twice a day. We're gonna floss around that implant really well with, if you have a thick floss, that's even better because it can go and you just wrap it around the implant and you kind of clean it up. And after that, use a water pick. Water pick alone is not enough. It is not enough, so please brush twice. We're gonna floss and wrap it around that beautiful implant and clean it every day. And then at the end, like that's usually at nighttime, and then at the end, just a little bit of water pick to kind of flush everything. Now, another big myth, can implants cause cancer? I was asked that question before, and this is an absolute no. There is nothing in the literature that's connecting actually implant or dental implants with cancer. So this is not true. Okay, now we know what is an implant. Basically, there are like 3 parts of an implant and the type of crowns, if it's a cement-retained. Cement-retained is the one that we just glue it on, not the screw on. And are implants dangerous for your body or not? And now the big question, now the big debate, because I'm getting actually a lot of comments about zirconia implants. Are they safe? Why are we using titanium and we're not using zirconia? Okay, this is a very good episode now, because let me explain something to you. So titanium implants, they've been out in the market since the 1960s when Brennemark, the big godfather of implant dentistry, started it. And titanium, there is a lot of research about titanium. It's a biocompatible, and it's like basically tons of research was done around it. And it's much more durable than zirconia, and I will explain why. And it's a 2-piece system. Remember what I said? Now we have that root, which is the implant, and then comes on top of it the abutment, and then you put on top of it the crown. With the zirconia, it's a little different. So when you have now the titanium ones, you have the root, and then you have that top part, which is basically called the abutment. You can get something not just straight, but you can have the abutment angled. So let's say the bone, your bone, it's not like nice and thick and straight like this. It's like it's tilted. So the implant now is placed this, and now we need to put the crown properly, so you are talking and smiling. So we have to use sometimes an angled abutment. So the abutment is not really straight with the implant, it's a little tilted. That can be done with the titanium implant, not with the zirconia implants. And that's because of the pressure and the forces that are coming directly down on the implant. Of course, the best line, if we can get a perfectly aligned implant with the crown, this is the best, but sometimes we can't. So what do we do? How do we get around it? Do we just basically tell you we can do it, go get dentures? No, there are solutions. And the solution is that, the angled abutment. That cannot be done with zirconia, okay? Now, so you have to think about this part. Zirconia, They came out on the market like around 20 years ago. So there is not a lot of research around them. And I was one of I've been doing this for what now, 15 years? There is not a lot of research done around zirconia implants yet. It's not enough. But of course, they can be a good alternative for people, who have some allergies. They cannot get titanium for some reason. So yes, it is a good alternative, okay? Now, zirconia, the problem with it, it's very brittle. So sometimes when you are putting it in, it can crack. If you're putting a lot of forces on it, it can crack. Titanium hardly does that unless if you are fighting on rocks, basically. I've had one patient, actually, she cracked her implant from grinding, severe grinding, because she wasn't wearing her night guard. This is a true story. I couldn't even believe it, but she did it and we ended up removing it. So back to the story. So zirconia are brittle, so they are more prone to fracture, more than a titanium implant, okay? Now, they also, according to some of the literature that came out, they say that it doesn't really accumulate plaque around it because it's much more biocompatible than a titanium. So this is a plus for a zirconia. And the bigger really thing is that, the color. So sometimes when you put a titanium implant, if you don't have nice thick gum around it, sometimes the metal can show through it. And also depending on the angulation, if it's not really pushed more in, if you put the implant and it's more outside in the jaw rather than in, then you have more kind of see through. So the gum can start to look a little bit grayish underneath, the gum, you can see a little bit of grayish. With the zirconia, you don't, because it's a white one, so it's kind of masked. Anyway, this is really the big debate now between, should I get a titanium, should I get a zirconia? So zirconia, I would say it's mostly for people who can, have some allergies from a lot of metals, and, they need something more hypoallergenic and the color. But don't forget that it can fracture. It's not as strong. But also the biggest difference really is, remember what I said about titanium? You can use an angled abutment. With zirconia, you cannot. And why is that? Because it's brittle. It can crack. So most of them, they come in one piece. It's just a one piece zirconia implant, and that's it. You cannot have an different angulation. So this is something for really the people who have perfect bone, perfect measurement, perfect everything. Okay? Hope that kind of explained a little bit the difference between titanium and zirconia implants. Now, who can get a dental implant? Anybody really can get a dental implant. You have bone in your mouth, then yes, you can. Even if you don't have bone, we can grow bone. We can. Yeah, we can do a lot of stuff. How do we grow bone? That's a whole different episode, but we can. Sometimes we can do ridge augmentation, and then we wait, and then we put the implant. Or remember the lady with the sinus, we do a sinus lift and push the sinus membrane up, and we can put an implant. So we can do a lot of stuff. So it's really for everybody who who can take care of them. Now, implants are not for life, okay? This is very important. The maintenance is very, very, very important. Nothing lives forever. And I want everybody to understand that part, because as I said with the other patient, I'm gonna have metal and fake teeth, it doesn't matter. Yes, it does. Yes, it does. Because, of course, the ultimate goal would be to keep them in as much as possible for the longest, until you forever. But the reality is you still have to maintain them. You still have to brush around them. You have to floss around them. You still have to go get your checkups done. You really need to get x-rays done just to monitor, if there is any bone loss. And also a big part of it is your health. If you are healthy or not, if you are smoking, if you have uncontrolled diabetes, if you're taking immunosuppressant, if you have osteoporosis, all of that can affect the implant. If you are grinding, you should wear a night guard. I always tell patients, when you get an implant, you really should wear a night guard, period. Even if you get you have to wear something to prevent excessive pressure, because sometimes you're grinding and you don't even know it. So I hope that kind of explained few things. Now, who do you go to when you decide I want to get an implant? Well, of course, you have to do your own research. And this is in one of my other episodes that I spoke about. You have to go to a dentist who they really know what they're doing. And definitely they are going to tell you, I need a CBCT. If a dentist tells you, I'm going to take a small x-ray, yeah, you got good bone, let me put it in. This is not the standard of care. The standard of care really is to get a 3-dimensional x-ray, because this is 50% of the treatment plan, and the success of the implant really is based on that part alone. Proper treatment planning. That's what I told the patient. I'm going in and I know exactly what I'm doing. I'm not gonna be like, oh my God, I don't know, the bone doesn't look good, oh, your gum is like this. No, we go in and out. This is, this is how it's supposed to be done. You go to a skilled dentist, and I'm here, guys. If you need any consultation, I'm gonna put in the show notes below how you can contact us. We are in New Jersey, but we take patients from pretty much all over the world at this point. So make sure if you need any consultation, you send me a comment, or even to the website. So very important now is also the post-operative. What is that? Okay, I got an implant now, I have stitches, and then you go and you disappear, and you don't take your antibiotic, and you're not taking the painkiller because it doesn't hurt me. The painkiller is mostly an anti-inflammatory. It's not just, okay, I mean, it is for pain, but it's really mostly an anti-inflammatory, because I don't want the cells to be like, oh, now they're looking at the implant, they're like, something is weird here. Let's gather each other. Let's get all those beautiful white blood cells and let's go attack. I don't want that to happen. I need the inflammation to subside down. Okay? Remember when we talked that it can be rejected? Hardly because of this, but I mean, you don't want any inflammation there. I don't want any inflammation. I don't want any allergies. I don't want any infection. And how that can happen? You take your antibiotic as prescribed, not like, oh, it's 3 times a day. Let me take them all. 3 times a day means every 8 hours, guys. And I'm serious now. Some people, they're like, oh, I just took the pills. It's every 8 hours. And then you take the painkiller. It's the anti-inflammatory. The strong painkiller, the narcotic, that's usually, if you really have pain, okay? The allergy medicine is mostly usually for the top teeth. If you have an implant in the upper jaw, lower, hardly anything. So, but you still have to take the antibiotic and the anti-inflammatory. And I also like, the patients to take some calcium over the counter and a little bit of vitamin D also over the counter, because it helps with the absorption of calcium. Okay? Nothing crazy here. And of course, you have to go for your regular checkup. So did you get a checkup recently? Did you get your x-rays done? X-rays are very important, because the dentist, I mean, we appreciate that you guys trust us. We don't have x-rays in our eyes. So I cannot really tell you if there is a problem or not without it. I'm going to do it next time. And then next time you say it's next, we can't. We cannot see you if you don't get x-rays at least once a year. At least. This is also the standard of care. Okay, I hope it wasn't too long, but I really enjoyed it. And make sure you subscribe, comment, and like the episode, and basically the whole podcast if you liked it. We're now all over. I think we're like on iHeartRadio, and we're getting there. And I really appreciate you guys. And make sure send me any comments, or if you have any questions, put them in the link below here, and I'll see you around. And don't forget to keep brushing and flossing and take care of your teeth so that they can take care of you. Until then, keep smiling with Dr. Saad. Have a good one, everybody.